Okay, so now I'm going to present some of the data from GU ASCO, looking at some of the prostate data that was presented. So the first study, essentially, we're using a lot of immunotherapy now. We want to know, does immunotherapy work in prostate cancer? We've seen sipuleucel T in the past. Now we haven't really had much success so far looking at early data on PD-1 inhibition. But here was a study presented by De Bono from England, looking at, does Pembro have activity in prostate cancer? There were different cohorts based on PD-L1 levels, showing response rates really not that encouraging, showing response rates of around about 10%. Nothing new that we didn't know before, but this is what we saw in this trial. This is the waterfall plot. The first author was very keen to stress, look at the end, that end group of patients. Maybe there's a small subsection of patients that are having some impressive responses. But overall, this waterfall plot is not encouraging. We're not seeing that for most patients that this is going to be a good option. Maybe there's a small subset of patients that will benefit from this. The question is, do we know how to select those patients? So actually, De Bono and his group started looking at these patients who responded, have been doing some genomic sequencing on them, trying to look and see if they can understand which of the patients, if they can select which patients are going to respond and which ones aren't. This is hypothesis generating early data. This is not telling us yet anything of any substance. But I think, if there are 10% of patients that can respond potentially with some level of durable responses, great. We just need to know how to select those patients.